Our spines are the backbone and foundation of our bodies. Made up of 33 bones called vertebrae, the spine protects our nerves, supports the torso and dictates our movements. Given the daily burden, the spine gets a lot of wear and tear.
Back pain is certainly very common. In fact, many studies have shown that up to 80% of the population will have back pain at some stage in their lives. Usually, patient presents with acute low back pain. They, out of the blue, they may get a sudden onset of pain to the back. Now, in some situations, the pain may come on more gradually and become worse and worse, and they will have problems in either sitting too long or walking too long. They may suffer from too much of back pain. Now, then, in these situations here, they find it difficult to lie down or sit down for a long period of time. Now then, and some patients, they may also experience pain radiating down to their legs as well, and they may experience some numbness going down to the legs.
Back pain persisting more than 3 months is chronic. See a doctor to rule out any serious medical problems. Pain may indicate an underlying condition like degenerative disc disease or a herniated disc.
Here, this is a model that shows that how a hernia prolapsed disc would occur. In this situation here, we also see that the nerve coming out of the foramina here, the hole here. Now then, the time when the disc protrudes out, it may presses against the nerve roots here, and this results in pain and sciatica. So here, the disc here presses against the nerve roots as it comes through the hole, and this results in severe low back pain.
Cervical or neck pain is another common medical condition. It affects the first 7 vertebrae comprising the cervical spine. These bones are surrounded by muscles, ligaments, and nerves. The discs between the vertebrae act as shock absorbers for the spine. Neck pain is often due to a muscle strain or other soft tissue sprain of the neck structures. These injuries can result from a car accident or from straining the neck, such as carrying heavy loads. Cervical spondylosis is another cause of neck pain. No age is immune to back pain. About 12% to 26% of children and adolescents suffer from it. Men and women are equally affected. Most lower back pain is acute and will resolve itself with or without treatment. If symptoms persist beyond 3 months, the condition is considered chronic. Most back pain occurs between the ages of 25 and 60. David has just finished national service in Singapore and is waiting to go to university in the United Kingdom. At just 20 years old, he has been diagnosed with disc degeneration.
Actually, I've had issues with my legs since I was a kid, and it's always been a bit hard for me to walk for prolonged periods. But I just, never expected it. I mean, nobody diagnosed it, nobody suspected. Just, one day kind of realized that, hey, there's something wrong. I've had it apparently for 5 years, but before a couple of years ago, I didn't even know that I had it. So basically, one day I just couldn't stand up, and I realized that the condition was getting worse, and I was officially diagnosed with disc degeneration. Well, it's not that bad yet, but I expect to be much worse when I get older because, I mean, even now, it's not exactly easy for me to take a long walk or even jog down anywhere. So physiotherapy has helped, but it's not the most comfortable thing to have in the world. So I kind of miss the days where I could do anything and not really worry about what it's doing to my back.
What seems to be bothering you?
I'm having a few
The
problems.
effectiveness of
Basically,
back pain
whenever I'm
treatments
sitting for a long
varies from
duration
person to
or
person.
Standing for a long duration, I'm getting radiating pains starting
The
from my
doctor
back
will generally
and
begin
the
by
back
asking
moving
about
down to the
symptoms
bottom
and taking a
of my
medical
calf.
history.
How long have you been having this now?
I've had this for a few years.
This will be followed by a
definitely
physical
more than 5.
examination.
And basically, it gets aggravated the longer I stand or the longer I sit still.
When we see these patients, it's important to examine them to see the location of the pain and whether there's any muscle spasms in the area and how much flexibility there is in the joint. So we ask them to bend forward and bend backwards and so on. Now then we also want to examine them neurologically to see whether there's any nerve compromise. And so after examination, we usually would want some radiological investigations. Here we see that to start off with, we usually request for a plain X-ray. And with the plain X-ray, we will be able to see whether there are any degenerative changes to the bone. And also we'll be able to see how big is the gap between the vertebrae. Now then with this, then we'll be able to give some idea as to whether the disc has prolapse or not. But in a lot of the situations, we may not be able to because the plain X-ray would only show the bone structure. So sometimes, if the condition is severe, then we may well need to do a more detailed investigation like an MRI. An MRI will be able to see the soft tissues, including the disc and the nerve. And with this, we will be able to assess to the severity of the prolapse to the disc. When we do an MRI, you can see that the MRI here, that in a normal situation, the disc looks like this, where we see the nucleus annulosus, the annulosus here, and the nucleus pulposus here. Here we see it as a bright spot surrounded by a dark rim capsule here. These are the bones of the vertebra. In this situation here, this disc is diseased in that it is dried. One cannot see the actual bright nucleus pulposus already, and is herniated out. And this results in the disc material protruding out into this canal, resulting in nerve compression here. Now then, some patients may get pain to the buttock area. Sometimes it may be to one side, sometimes it may be to both sides. And again, we see that more MRI pictures of the condition in that the disc is pressing against the nerve here. And in this situation here, the disc material has traveled upwards to almost to the next level. So MRI does play a very significant role into helping us to make the diagnosis and to assess the severity of the problem.
Through physical therapy, David learned habits and principles that helped him to work on strengthening the back, neck, and core muscles.
Here, is it?
Actually, the physiotherapy treatments were mainly focused on, firstly, they were to reduce inflammation. So I had some ultrasound therapy, which basically relaxed the muscle and tried to reduce the inflammation so that the initial symptoms would go away. After that, I went for classes every week, which focused on strengthening my core muscles, which would take some of the weight away from my spine. So it's basically helping me with my posture, and yeah, it's helped a lot. And basically now I can function pretty normally, about the same as before my injury. So things are getting better, but I just hope they won't get worse.
Yoga has consistently been used to cure and prevent joint pain by enhancing strength and flexibility. Stress can lead to muscle tension and back problems. Back pain can also come as a result of tight hamstrings and weak abdominal muscles. Adopting a therapeutic regime like yoga can help ease the pain, but if done wrongly, it can worsen the injury to the joints.
I think yoga certainly would help in that yoga essentially helps to maintain the flexibility of the joints, and that will maintain the range of motion of the neck. So these are some of the exercises the patients can do in order to strengthen the neck muscles. Now, by pushing the head against resistance, either in a forward motion or a backward motion or side-to-side motion. By building up strong muscles around the neck, that will reduce the force going through the spine and hence reduce the likelihood of spondylosis. If symptoms persist, then one may need to remove the mechanical component by doing an operation. This operation is known as fenestration and discectomy. Fenestration means making a small window through the back, and then once we're there, we then remove the part of the disc that is pressing against the nerve root. Here we see that this is the MRI, and this patient had this piece of the disc material removed during the operation. Now then, this operation usually would take about 2 hours to perform, and that the patient more or less can walk the next day, but usually most patients will stay maybe an extra day before they are being discharged from the hospital. The neck pain is also very common, and the similar process also occurs in the case of the back. In the case of the back, one may see young patients coming to see us with neck pain, and that they will have, in addition to neck pain, they may also get pain and numbness radiating to the upper limb being the outer part of the arm and the forearm. And that in addition to pain, they may also suffer from numbness.
Treatments for neck and back pain are very similar. For long-term relief, lifestyle changes must be undertaken. Exercise maintains muscle tone to strengthen the spine and keep it flexible. Like any fine piece of machinery, maintain the spine and it will give us good service and perform for many, many years.